Most people over 60 believe diabetes shows up in a blood test first, but the truth is far quieter and far more dangerous. By the time your lab results change, your body may have already been changing for months, sometimes years. I have seen patients who felt completely fine, yet their nerves were weakening, their circulation was slowing, and their skin was quietly losing its ability to heal. And the most alarming part, the earliest warning signs don't appear in a lab. They appear in your feet, a slight tingling that comes and goes, a strange burning sensation in the middle of the night, skin that cracks and never heals the way it used to. These are the signs most people ignore, assuming it's just age, dry weather, or poor sleep. But after 60, the body does not send signals without a reason. And when your feet begin to change without explanation, it may be your body warning you about something far more serious. In the next few minutes, I will show you the warning signs most people miss, why they happen, and what you can start doing tonight to protect yourself. Because if you ignore these signals, the damage may go further than you think. And in some cases, it may not be reversible. Have you ever noticed that one foot goes numb so easily now that you barely react to it anymore? That matters. It matters more than most people realize. One of the earliest ways high blood sugar affects the body is by irritating the tiny nerves in the feet, especially the longest nerves, the ones that have to carry signals all the way down from the spine to the toes. Those nerves are delicate. They do not like excess sugar. Over time, sugar and inflammation begin to injure the protective covering around them, and once that process starts, the message from your foot to your brain becomes less clear, less accurate, and less reliable. At first, it feels small, a little tingling, a patch of numbness. The strange feeling that your sock is bunched up when it is not. Then it begins happening more often, not after sitting awkwardly, not after crossing your legs, just because. I have reviewed case after case where the contributing factor was something completely ordinary. A person told me they thought their foot was just falling asleep. More often, another said it felt like they were walking on cardboard. Another said the shower water seemed less warm on the bottom of one foot than the other. They were not imagining it. Their nerves were losing precision. Think of it like the wiring inside an old house. At first, the lights still turn on, the system still works, but the signal flickers, a switch feels unreliable, a lamp buzzes for a second before it steadies. That is what early nerve damage does. It does not always shut sensation off completely. Often it blurs it first. And here is what makes this even more serious. When the nerves lose feeling, you stop getting the warning signals that protect you. You may not notice a tight shoe. You may not feel a seam rubbing the same spot for 2 hours. You may not realize you stepped on something sharp in the kitchen or that a blister has formed on the side of your toe. The pain signal is gone, but the damage is still happening. That is how a nerve problem becomes a skin problem. And then a skin problem can become an infection. Clinical data makes this very clear. About half of people living with diabetes develop some form of nerve damage over time, and the feet are often where it starts. What frightens me is not just the number. It is the silence. Many people do not feel dramatic pain in the beginning. They simply notice less sensation, less temperature awareness, less warning. In my years of working with cardiac patients, I learned quickly that the same blood vessel stress that threatens the heart often shows itself early in the feet, because the feet are far from the center of circulation and very dependent on healthy nerves and tiny blood vessels to stay protected. When the feet begin changing, I pay attention. So here is what I want you to do tonight. Before bed, sit down somewhere with good light. Slide off your shoes and socks. Press your fingertips gently along the bottoms of both feet, each heel, each toe, and the outside edge of each foot. Ask yourself a simple question. Does one area feel duller than it should? Then take a 10 to 15 minute walk after dinner, even if it is only inside your home or down the driveway, because gentle movement helps glucose move out of the bloodstream and keeps blood flowing to those small nerves. Now this next one is the one I want you to take most seriously. Do your feet ever feel hotter at midnight then? They do in the middle of the day? That is not a small complaint. That is not just bad circulation in the vague way people often use that phrase. Burning feet at night can be one of the clearest signs that the small nerve fibers are irritated and misfiring. During the day you are distracted, you are moving, your brain is busy with conversation, television, errands, noise. But when the house gets quiet and you finally lie down, the signal becomes louder. The same irritated nerves that whispered in the afternoon begin shouting after dark. I have sat in recovery rooms and asked this exact question, not because it sounds dramatic, but because people remember it. They tell me their feet feel hot under the blankets even when the room is cool. They uncover them for relief. Then they get cold. Then they cover them again. It becomes a cycle. They lose sleep. They become more exhausted. And the next day they are less active, which can make blood sugar harder to control. This is how one problem feeds another. A nighttime nerve problem becomes a sleep problem. A sleep problem becomes a metabolism problem. Then the metabolism problem drives more nerve irritation. Think of a smoke detector with a damaged sensor. There is no fire in the kitchen, no real flames, but the alarm keeps sounding because the sensor itself has become unstable. That is what damaged nerve fibers do. They send heat and pain messages even when nothing outside the body is causing them. Research has consistently shown that painful nerve symptoms can appear early, sometimes before a person ever receives a formal diagnosis. That surprises people. They assume diabetes only counts once a lab number crosses a line. But the body lives in the real world long before the chart is updated. Tissue does not wait for paperwork. And there is another piece to this that people miss when blood sugar runs high after dinner, especially after a meal loaded with refined starch and sweets. The bloodstream becomes a rougher environment for those already stressed. Nerves add dehydration to that, which is common in older adults because thirst signals become less reliable with age, and nighttime symptoms often get worse. The nerve is irritated, the fluid balance is off, the person lies still, the sensation intensifies. I have watched this same pattern repeat itself over and over. Someone tells me they thought the burning was from getting older. Then they tell me it happens most after a heavy evening meal. Then they tell me they keep a fan by the bed because their feet feel like they are glowing from the inside. That is not the kind of detail I ignore. So here is your practical fix for tonight. Make your last sweet snack earlier, not later. If you are having dessert, have it with dinner, not at 9 o'clock. Drink a full glass of water with that meal unless your own doctor has told you to restrict fluids. Then, before bed, do 60 seconds of ankle pumps and toe curls under the covers. It sounds simple because it is simple, but simple things, done nightly, may calm the feet, improve circulation, and support steadier overnight blood sugar. Here is where it gets important. When was the last time a blister, crack, or sore on your foot healed as quickly as it used to? That question tells me a great deal. Healthy tissue repairs itself, not instantly, not perfectly, but it moves. A rubbed heel dries out and closes. A small nick stops stinging and begins sealing. The skin knows what to do, but when blood sugar stays elevated, healing slows down because the body's repair crew cannot get to the job efficiently. The tiny blood vessels that are supposed to bring oxygen, nutrients, and immune cells to the area become damaged. Traffic slows, delivery runs late, the wound sits there waiting. Then there is the second problem. Nerve damage often reduces sweat and natural moisture in the feet, especially in the soles and heels. So now you have less protection on the outside and weaker repair on the inside. The skin becomes dry, then rough, then cracked. A callus forms where pressure keeps building. A small split opens in the heel. It looks minor, it feels minor, but the body does not have much margin for error once healing is compromised. Imagine trying to repair a brick wall, with half the workers stuck in traffic and the other half never told the wall was damaged in the first place. That is what diabetic foot damage can look like. The blood supply is delayed, the immune response is weaker, and because sensation is reduced, the person may keep walking on the injured area without knowing it. That is how an ordinary crack turns into a wound that lasts too long. I want to be honest with you for a moment. I have spoken. Two families who had no idea anything was wrong, and I have sat across from people who came in expecting a routine conversation and left understanding that their body had been giving warnings for far longer than they knew. After years of seeing what actually causes these events, I can tell you the damage is often not mysterious at all. It is quiet, it is familiar, It is the tiny evening habit of ignoring what looks small because life is busy and the symptom does not seem urgent. That is why this conversation matters to me, because I have seen how much suffering begins with something a person thought was too minor to mention. And here is the chain reaction that concerns me most. Reduced feeling lets the skin get injured. Poor circulation slows the repair. Bacteria now have an open door. Infection starts. Once infection enters a foot that already has weak blood flow, treatment becomes harder. That is not fear talking. That is physiology. We know from decades of diabetes science that foot ulcers, infections, and even amputations are far more likely when nerve damage and poor circulation are allowed to travel together. One problem alone is dangerous. Two problems together are devastating. So tonight, after your shower, dry your feet carefully, especially between the toes. Look at the heels. Look at the sides of the big toe. Look underneath if you need to use a mirror. If you see a crack, cover it only after cleaning it gently. If you see a blister, do not pop it. Put moisturizer on the heels and soles if they are dry, but never between the toes where trapped moisture can feed fungus. And if a sore has not clearly started improving after a couple of days, do not wait and hope, make the call. This one surprises almost every person I share it with. Have you looked down in the evening and noticed swelling, deep sock marks, darker color around the ankles, or one foot that always seems colder than the other? People dismiss this all the time. They blame the weather. They blame salt. They blame a long day in the chair. And sometimes that is exactly right. But sometimes those changes are telling you that diabetes is affecting circulation and fluid balance, not just in the feet, but throughout the body. When glucose stays high over time, blood vessels become less flexible and more damaged. The tiny vessels struggle first, then larger circulation can begin suffering too. Blood does not move as freely into the feet. Fresh oxygen arrives less efficiently. Waste products leave more slowly. The skin can look dusky, reddish, or unusually pale. The feet can feel cold even under a blanket because warm blood is simply not arriving as well as it should. Now add swelling. If the socks are leaving a deep groove by late afternoon, that can mean fluid is collecting. Sometimes that is from standing. Sometimes it is from veins. But in many older adults, diabetes is also part of a larger picture that includes kidney stress and cardiovascular strain. The kidneys help control fluid balance. The heart helps move that fluid. The blood vessels have to stay open enough to carry it. When diabetes harms that system, the ankles often show it. Approximately 1 in 3. Adults with diabetes also has chronic kidney disease. That number should stop people in their tracks. Because when feet and ankles stay swollen, you are not looking at an isolated cosmetic issue. You may be looking at a fluid management problem that reaches far beyond the foot itself. And here is what makes this even more serious. The same vascular injury that can leave your feet cold and your ankles swollen is not politely stopping there. Those are the same kinds of blood vessel problems that can threaten the heart and increase the risk of stroke. The foot is not separate from the rest of you. It is a visible endpoint of what may be happening inside the circulation. Everywhere. I explain it this way. Picture your bloodstream as a highway system. Your feet sit at the end of the longest route. If the roads narrow, traffic backs up, deliveries arrive late, and the farthest town suffers first. That farthest town is often the foot. But the traffic problem belongs to the whole map. So here is the nightly fix I want you to remember. By early evening, ease up on salty packaged foods. If dinner comes from a box, a can, or a drive-through window, sodium may be quietly making swelling worse. After dinner, sit with your feet slightly elevated for 15 to 20 minutes. Then do 20 slow calf raises while holding the counter, or if that feels unsafe, point and flex your feet while seated. And if one foot is suddenly much more swollen, much more painful, much redder, or much colder than the other, that is not a wait-and-see situation. That deserves prompt medical attention. Now stay with me on this one because most people have never heard this explained this way. Have you started walking a little differently lately, especially in dim light, on the stairs, or when you get up at night? That change may be coming from your feet long before you blame your balance. Many people think balance lives in the inner ear alone. It does not. Balance also depends on constant information rising from the soles of the feet to the brain. The brain needs to know where the floor is, how much pressure each step creates, whether the toes are gripping, whether the ankle is adjusting. When sensation fades, the brain loses part of its map, and when the map grows less clear, the walk changes. It starts subtly. You reach for the wall at night. You shuffle a little more in the dark. You feel unsteady when you first stand. Maybe you avoid uneven ground. Maybe your family notices before you do. Some people also notice the muscles in the feet look flatter. The toes do not spread the same way, or the top of the foot and lower leg seem to have less hair than they used to. That thinning can be another quiet sign that circulation to the area has been reduced for a long time. I have seen people focus on the wrong fear here. They worry about the fall. And yes, the fall matters. But I worry about the reason behind the fall. Because if diabetes is damaging sensation, weakening the small muscles of the foot, and reducing circulation at the same time, the body becomes less stable from the ground up. Think of your feet like the foundation under a house. If the foundation becomes numb, dry, weak, and poorly supplied, everything above it has to compensate. The knees work harder. The hips tighten. The person moves less because movement feels less safe. Then blood sugar control often worsens because activity drops. This is how a foot problem can become a whole body problem. Less feeling leads to less confidence. Less confidence leads to less movement. Less movement can worsen glucose control, circulation, and mood. Studies have consistently shown that peripheral nerve damage in older adults is closely tied to greater instability and higher fall risk. That matters after 60 because one fall can steal months of independence, sometimes more. So here is what I want you to do tonight. Before you turn off the lights, stand behind a sturdy chair and slowly rise onto your toes 10 times if it is safe for you to do so. Then lift your toes while keeping your heels down 10 times. Put a night light between the bed and the bathroom. Wear supportive indoor shoes rather than walking barefoot on hard floors. And if you have noticed a new change in balance along with numbness, burning, coldness, or slow healing skin, do not treat those as separate mysteries. They may be connected by the same cause. Let me bring this together in a way you can actually use. I do not want you leaving this conversation frightened. I want you leaving it awake. There is a difference. Fear freezes people. Clarity helps them act. The good news is that many of these warning signs do not mean the story is over. They mean your body is asking for attention now. The earlier you respond, the more options you usually have. So I want to give you a simple routine, a real one. Something you can remember without writing it on the fridge. I call it the 6 to 10 foot guard. By 6 in the evening, make dinner the point where the sugar rush ends, not begins. Build the meal around protein, fiber, and something fresh if you can. If you want bread, rice, pasta, or dessert, keep the portion honest. The goal is not perfection. The goal is a steadier night. At 7, take your short walk. 10 minutes is enough to begin. 15 is better. 20 is excellent. Indoors is fine. Outside is fine. The point is to help your body use glucose instead of letting it. Between 8 and 9, do your foot check. Look at the heels. Look. Between the toes. Look for redness, swelling, cracks, blisters, calluses, dark spots, or a wound you had forgotten about. Touch both feet and compare them. Do they feel the same temperature? The same sensitivity? If not, pay attention. By 9:30, moisturize the dry skin on the heels and soles, not between the toes. Drink water if you have not had enough through the day and your own doctor has not limited your fluids. Then do 1 minute of ankle pumps and toe curls to keep circulation moving before bed. By 10, make the room ready for safe sleep. Put on clean socks only if your feet feel cold and the socks are loose, soft, and non-binding. Use the night light. Keep the path to the bathroom clear. If burning feet wake you, notice what you ate, how hydrated you were, and whether the symptom is becoming a pattern. Patterns matter. That is the 6 to 10 foot guard. Not dramatic, not expensive, but powerful because it catches what denial misses. And let me say one more thing, if you have 2 or 3 of the signs I talked about tonight, numbness, burning, cracks that linger, swelling, color change, cold feet, balance changes, or a wound that is not healing the way it used to, schedule the blood work. Do not argue with yourself for another month. Do not wait until the pain becomes severe or the skin opens further. Get it checked. A simple conversation and the right tests can change the direction of your health much faster than wishful thinking ever will. If this helped you connect the dots, tell me in the comments which warning sign surprised you most. And if someone you love has been brushing off foot symptoms as just getting older, please share this with them tonight, because sometimes the most caring thing we can do is help one another notice what the body has been trying to say. Everything shared here is general health information based on current research, not a substitute for your personal medical care. Before making changes, especially to your medications or diabetes treatment, please speak with your own doctor. That is not a formality, that is genuine care for you.